Hi everyone, Dr. Knackstedt. Let's talk about a concept that I think gets misconstrued all the time on social media, and that's the difference between repleting your nutrients to a normal level of something versus targeted supplementation before an event like surgery. So let's say you go to the doctor and you get some blood work and it comes back and your vitamin D levels are low. Your doctor might recommend that you take supplemental vitamin D to get you up to normal levels. Now, we can argue all day about whether that normal level is high enough. I think it's not, but that's for a different video. That type of supplementation is very different than if you come to me for surgery and I say, you need extra vitamin D, protein, whatever the supplement is, in order to give your body the adequate building blocks that are above and beyond its baseline needs in order for you to heal well. Let's talk about two studies that will help illustrate this point. So this first study looked at abdominoplasty or tummy tuck in massive weight loss patients. Why this is relevant is that massive weight loss patients are often protein deficient. So when this study took massive weight loss patients and gave them protein supplementation and found that by doing so, their complication rate was similar to patients who hadn't had a history of massive weight loss, it was kind of like the supplementation was bringing them back to normal levels. Does that make sense? They were probably deficient, brought them back to normal, decreased their complication to someone who didn't have that same risk factor. Now, that is very different than this study, which took patients who were about to undergo spinal surgery and gave them protein versus no protein. So these patients weren't baseline protein deficient as demonstrated by any lab test or clinical measure, but the study still found that giving them protein decreased their complications. So I interpret this study as didn't matter what your baseline protein deficiency or non-deficiency was, didn't matter what your baseline intake was on a day-to-day basis, protein supplementation still overall decreased complications. So this is what I'm talking about when I talk about targeted supplementation before or after surgery. It's not just what your body needs on a day-to-day basis. It's what your body needs to heal from surgery. You need to go above and beyond your basic diet, even if your diet is incredibly healthy. And that's why I think that almost anyone could benefit from strategic supplementation before or after surgery. But as you can see, this is kind of a very nuanced topic and gets very easily misconstrued all over social media. Have you heard about this idea before? What are your thoughts? Let me know below.